Pulsed electromagnetic field therapy. The concept of using magnetic fields to treat health conditions was first documented in the 1600s. This technology was revived in the 1970s by Bassett, who introduced a biphasic low-frequency signal that he used to treat delayed union fractures in patients. Today, pulsed electromagnetic field therapy is one of 6 different types of electromagnetic fields that are used for therapy. As the information continues to evolve and research continues to be done, pulsed electromagnetic field therapy has expanded beyond facilitating just fracture healing. Pulsed electromagnetic field therapy uses a frequency between 5 and 300 Hz. The specific shape and amplitude of a signal vary by the manufacturer. The most basic signal is described as a pulsed electric semi-wave with a low frequency and intensity. This signal produces a magnetic field within the tissue and exposes the tissue to an electrical current. In the United States, the FDA classifies most pulsed electromagnetic field therapy units as a Class 3 medical device. In Europe and Asia, pulsed electromagnetic field therapy devices have been utilized to treat clinical problems other than fracture. Pulsed electromagnetic field therapy creates a current that affects the sodium pumps within the cell membrane. The electromagnetic field created influences cell function and could improve the physiological function in damaged tissues. The physiological effect attributed to pulsed electromagnetic field therapy include a change in cellular calcium, changes in cyclical adenosine monophosphate in the human fibroblast, increases in collagen, proteoglycan, DNA, and RNA synthesis, increase in reactive oxygen species and nitric oxide, and decrease in pro-inflammatory cytokinins. Osteogenesis is bone growth. Pulsed electromagnetic field therapy has been successful in facilitating bone osteogenesis in animal models and in human tissue models. Pulsed electromagnetic therapy has been determined to be effective to improve bone health in patients with fractures, non-union fractures, and osteoporosis. A 2013 study demonstrated that pulsed electromagnetic field therapy was as effective as common pharmacological treatments at maintaining lumbar bone density in patients with osteoporosis. A randomized, double-blind, placebo-controlled study assessed the effectiveness of pulsed electromagnetic field therapy treatment on patients who had undergone arthroscopic debridement and microfracturing for talar osteochondral defects, and found that the treatment had no effect in bone repair, time to return to play, or several patient-oriented outcomes. Circulation. Increased blood flow enhances the supply of nutrients and oxygen to tissues and removes waste from those tissues. This is all required for proper tissue function and healing. The effect of a magnetic field on blood perfusion and blood pressure are mixed. In a 2007 literature review, 10 of the 27 studies demonstrated that pulsed electromagnetic field therapy increased vasodilation, blood flow, or blood pressure. However, more than one type of pulsed electromagnetic field therapy was utilized in these studies. When isolated, only 3 out of the 4 studies demonstrated an increase in blood flow or vasodilation. A placebo-controlled double-blind study demonstrated an increase in arteriolar and venal flow as well as arteriovenous PO2 differences. Venous flow was increased in both healthy and diabetic individuals in the studies. Based on the current literature, the physiological effects include decreased inflammation, decreased pain and soreness, decreases in fatigue, enhanced heart rate recovery, enhanced fracture union, enhanced immune response, increased blood perfusion and microcirculation, increased intracellular oxygen delivery, increased metabolic waste removal, increased nutritional delivery to cells, improved wound healing, and stimulation of the chondrocytes. Based on the physiological effects and existing clinical controlled trial evidence, pulsed electromagnetic field therapy is indicated for the following conditions: avascular necrosis, chronic regional pain syndrome, type 1 and type 2, enhanced healing, cartilage repair, fractures, enhanced recovery from exercise and physical activity, fatigue, fibromyalgia, inflammation, improved circulation, muscle soreness, multiple sclerosis, osteoarthritis, osteoporosis, Parkinson's disease, pain, and stiffness. The reported contraindications for pulsed electromagnetic field therapy include the following: organ transplant and currently taking immunosuppressant drugs, and stem cell therapy. The precautions for using this modality include the following: the patient utilizing a pacemaker, having cancer, using a neurostimulator, pregnancy, or even having a history of stroke. The evidence associated with pulsed electromagnetic field therapy: avascular necrosis. In a 2017 systematic review, they found that pulsed electromagnetic field therapy was effective at improving early FICAT stages. The FICAT classification grade osteonecrosis based on radiographic findings. For back injuries, a 2016 systematic review supported the use of pulsed electromagnetic field therapy for the treatment of low back pain and demonstrated improved function using the OSWASTREE Disability Index, or the ODI. Of the 5 studies included in the review, all were associated with a decrease in pain when patients were treated with pulsed electromagnetic field therapy, including a large effect size for pain. For fractures, a 2011 Cochrane review concluded insufficient information to support pulsed electromagnetic field therapy for long bone fracture treatment. A 2014 meta-analysis concluded no differences to controls for treatments of the non-union fractures. For osteoarthritis, a 2009 meta-analysis found no difference in pain or stiffness levels, but improved activities of daily living and patient-oriented outcome scores. A 2010 randomized control trial with placebo control concluded that this therapy was ineffective as measured by the Western Ontario and McMaster University's Osteoarthritis Index, also known as the WOMAC. In 2015, a placebo-controlled, double-blinded study including pulsed electromagnetic field therapy demonstrated decreased pain and stiffness when patients were treated twice a day for 18 days. In 2016, a double-blinded, placebo-controlled, randomized controlled trial also found that pulsed electromagnetic field therapy improved function as measured by the WOMAC, and patients reported a reduction in pain using the visual analog scale, also known as the VAS. Pain. In 3 double-blinded, randomized controlled trials, pulsed electromagnetic field therapy reduced pain. A 2016 randomized controlled patellofemoral syndrome trial included patients who were treated for 6 weeks with home exercise programs, along with the pulsed electromagnetic field therapy. The patients reported less pain at 6 and 12 months post-treatment. So how to use this unit if you have one. If you have a Beamer body mat for generalized treatment, you first turn on the Beamer unit. Choose the level of therapy frequency based on the B body mat connected to A1. Press the intensity button. Press the level of the therapy frequency on the B body mat connected to A1. Please note that most patients start at level 2, but may increase. High-level athletes can start at level 3 or level 4. Press the plus button to turn off the plus mode. This default is always on plus. Make sure that the plus mode is off. Press the start button and the session will last 8 minutes on the B body mat.